We'll give it another minute or so and then we'll get started.
I'll working with them. It'd be great. Maybe get to know them better if I've been.
Right, I think we can probably get started. It sounds like the beeps in have stopped. Good morning and thank you for joining us today. I'd like to call this meeting to order and state adequate notice of this meeting pursuant to the Open Public Meetings Act NJSA 10-4-10 has been complied with and shall be entered into the minutes of this meeting. My name is Melissa Bellamy. I work with the County Division of Housing, and I'd like to go around and do introductions. Let me go first to Eileen.
Hi, can you hear me?
Yes.
Okay. Eileen O'Donnell, co-chair of or vice chair of the COC and executive director of Coming Home. Good morning.
Morning. I'm going to go through and run through the list of people. It's going to how it appears to me alphabetically. So if your first name is first, that's how it'll be. If your last name is first, it'll be by that. So we'll run down the list. You can just, when I call your first name, unmute, introduce yourself. If you have an agency you're from, your agency, and we'll just run through the list like that. So first person up today is Allison.
Hi everyone. I'm Allison Wisniewski from Woodbridge Township.
Thanks for joining today, Allison. Amy?
Thank you. Good to see you.
Hi, good morning. I'm Amy Flores. I'm with New Brunswick Public Schools.
Thank you for joining us too today, Amy.
Thank you.
Ashley?
Good morning, everybody. Ashley Watson, Community Alignment Specialist at Central Jersey Family Health Consortia. Happy to be here this morning.
Thanks, Ashley. Ashni?
Morning, everyone. Ashley Matthew from Monarch Housing Associates.
Thanks for being here, Ashni. Carolyn? Carolyn Timmons? Okay, we can.
Hi, can you hear me?
Oh, yes, now we can. Thank you.
Okay, I'm sorry. Good morning, everyone. Carolyn Timmons. I'm with Robert Wood Johnson Hospital Violence Intervention Program. I'm the program manager. Good morning.
Good morning. Thank you for joining us today.
Thank you.
Yep, great. Catherine?
Good morning, Catherine Centron with Women Aware.
Thanks, Catherine. And Chris?
Good morning, Chris Kime with Garden State Home.
Thanks, Chris. And Sandra?
Good morning, Sandy Batoni from the Middlesex County Office of Workforce and Career Development.
Thanks, Sandy. Corey?
Good morning, Corey Panatti, Supervisor Soldier On.
Thanks, Corey. Erin?
Good morning, Erin Stewart Romulus, Program Manager for Volunteers of America.
Thanks, Erin. Henry?
Good morning, Henry Busby, Middlesex County Veteran Services.
Thanks, Henry. Janie?
Hi, Janie Kazazian, America, Greater New York.
Great. I see Catherine just joined.
Hi, good morning. Catherine Jackson with Catholic Charities Diocese of Metuchen.
Thanks for being with us today, Catherine. And Jean Marie.
Good morning, Jane Marie Leach from Rutgers UBHC.
Oh, I love your background, Jean Marie. Jennifer.
Good morning, Jennifer Amaya, Director of Outreach and Prevention with Visions and Pathways. Sorry, I'm a few minutes late.
Oh, perfect. You were in time for roll call, so you're good. Catherine? Catherine Jacques?
Hi, sorry, I was just waiting to see which Catherine, because I see this.
Yeah, I figured that.
Hi, my name is Catherine Jacques. I am from the Jewish Renaissance Foundation. I am a case manager.
Great. Thank you for joining us today. And Lori G.
Good morning, Lori Giancatino, Middlesex County Office of Health Services, Special Child Health Services, and the Center for Empowerment.
Wonderful. Thanks for joining us today, Lori. And Linda?
Good morning, Linda J., Middlesex County Board of Social Services, Services / Emergency Assistance Program. Thanks.
Thanks, Linda. Lisa?
Good morning, Lisa Barnes, Member Advocate for Horizons MLTSS Program.
Thanks, Lisa. And Lori? Still muted, Laura. Oh, there you go.
Hi, good morning, everybody. Lori Friedman, RCHP, Affordable Housing Corporation. And I want to take a second to give a shout out to Malika, because she has been very patient and understanding with a lot of HIMSS stuff. You would think after all these years I would be comfortable with HIMSS, but I think that's just a very undeveloped part of my brain, and I appreciate you immensely, Malika.
That's nice.
You're
Great
welcome.
props. Great props for Malika. And Lou?
Good morning, everyone. Louis DiLucia from Garden State Home.
Thanks. And Malika?
Good morning, Malika Brown, Coming Home.
Hi, Malika. And Marco?
Good morning, everybody. Marco Zelaya, Homeless Program Manager, NJ211 Partnership.
Thanks, Marco. And Marilyn?
Good morning, Marilyn Crawford from New Brunswick Public Schools.
Thanks. Melissa?
Good morning, Melissa Lewis with the County Office of Human Services.
That you have to put that
Thank
word
you.
somewhere else
And
if you want it
Michael?
to play out properly. I mean,
Michael G. or Michael Day? Any Michael?
Hello. Yes,
Hi,
hi.
go ahead.
My name is Michael Davidson. I'm the HSAC Human Services Advisory Council Coordinator for Middlesex County. Sorry, I had another meeting I was just on and just ended.
No, that was
And-
perfect. Go
And
ahead,
Mike
Mike.
Gildenberg, Central Jersey Legal Services. Morning.
That's good. Michelle?
Morning, everybody. Michelle Graybell, Homeless Program Supervisor for Middlesex County.
Thanks. And Rita?
Good morning, everybody. My name is Rita Mirabelli. I'm here from the DCA Office of Homelessness Prevention.
Thanks. And Nancy?
Good morning, everybody. My name is Nancy Schneelak. I'm with Bridgeway Behavioral Health Services. We have the risk team in Middlesex County.
Nusrat? Okay, Ola?
Melissa, it looks like her computer is just, she doesn't have access to the mic.
Oh, okay. Ola, is he here? Unmuting? Maybe
That
he
was
had a
Ola.
step.
I'm sorry. I was speaking for her. Yeah, they put something in
Oh,
the
for
chat.
Ola. Oh,
Yeah.
okay, perfect. Thank you, missed that.
Mhm.
Raina?
Good morning, Reina Garcia, Outreach Representative for Zufo House.
Thanks, Raina. Thanks for joining us today. And Rena?
Hi, good morning, everybody. Rena Gitlitz, Rutgers UBHC Community Outreach Programs.
That's wonderful. Thanks for joining with us today, Rena.
Good to see you, Melissa.
Good to see you. Steve Nagel?
Good morning, everyone. Steve Nagel, Executive Director of Home Sharing.
Thanks, Steve. And Susan?
Susan Kramer Mills, Town Clock Community Development Corporation.
Wonderful. Thanks for being here. Susie?
This isn't Susie, it's Jen. My computer's not cooperating with me, so I'm logged in under Susie, and I can't change her name for some reason. But my name is Jennifer Roach. I am the Director of Housing and Homeless Services for the Raritan Bay Area YMCA's Center for Success, Support, Success, and Prosperity. Thank you.
Thanks, Jen. Talon?
Hi, good morning, everyone. Talin, this is Talin, System Data Analyst from Coming Home of Middlesex County.
Thanks, Talon. And Tanya?
Good morning, everyone. My name is Tanya Asmal. I am the outreach rep for Zufo Health.
Thanks. Great representation today. Thank you. And Barbara?
Hi, good morning. I'm Barbara Washington. I'm a integration specialist for the DCF Office of Housing. Unfortunately, I won't be able to stay long. I have a meeting at 10, so I'm just here to get whatever I can. Thank you.
It's okay. We'll make sure you get the minutes and everything afterwards. Zena?
Good morning, Zena Sutton from the Edison Housing Authority.
Okay, I have a couple people on phone calls. If you haven't already introduced yourself, a phone number ending in 8246.
Hi, my name is Denise Rivera. I'm from RCHP. I'm a housing case manager.
Oh, great. Thanks for joining us today. And then another phone number ending in 6694.
Kelly Telson, Edison Township Public Schools Community Liaison.
Oh, wow. Wonderful. Great representation from the schools today. So we're very excited about that. So thank you. Is there anybody I missed in the introductions? You can just unmute yourself and state your name and agency if you have one.
I just popped in. Sorry for being late. My name's Susan Giordano. I'm with Rutgers Robert Johnson Medical School Homeless and Indigent Population Health Outreach Project. It's wonderful to see you all.
Oh, that's great. Anyone else?
Hi, Melissa. This is Nusrat. Sorry, I am actually traveling. It's middle of the night, 9:30 p.m. over there where I am. So there was, I think, some internet glitch and I could not respond when you called my name.
Oh, that's okay.
So I am part of Chizori House, a project by Women to Women Forum, and looking forward to hear all the wonderful things.
That's great. Wonderful representation today on a day that we don't have, that we were worried we might not get a lot of people with being spring break for many school districts. So thank you all for being here. Do a screen share of the agenda. Okay, so the first item of business is, let me read our mission statement. The mission statement of the Middlesex County Housing Continuum of Care Committee is to stimulate community-wide planning and coordination of programs for individuals and families who are homeless, and unify and coordinate efforts to end homelessness in Middlesex County, New Jersey, so no one will experience homelessness and no one will be without a safe, stable place to call home. One of the reasons we go through the long introductions of names and agencies is it really helps everybody know who are their potential partners sitting here and to really hopefully increase the level of collaboration among our different programs. So even if you don't remember somebody's name, but you heard they were from a certain agency or anything, you can always reach out to Michelle Graybell or myself, and we can we can help put you in touch, but it's a broad network that we have, and that's really what makes us work so well and collaborate well together. I'd like a motion to approve the minutes of the March 7th meeting, and thanks to Michelle for preparing them.
So moved that they be accepted.
Thank you. That was Carolyn. And is there a second?
Sure,
Second.
I heard Steve. So all in favor, we can all just assume that you're going to say aye, but if you have a no or an abstention, you can put it in the chat. And great. So that is approved. We have a wonderful agency spotlight today. Nancy Schnetlock. I don't know if I'm pronouncing that. I apologize. From Bridgeway Behavioral Health Services, excuse me, to talk about the WRIST program. So I'm going to stop sharing and I'm going to let Nancy share her screen. The share button's on the top right next to the leave button.
Right.
If your team setup is similar to mine.
Got it. Thank you. I usually do Zoom, so thank you. So, okay.
Oh, perfect. We see it.
Okay. Thank you, Melissa, and thank you everyone for allowing me to come and speak with you guys today. My name is Nancy Schnelak. I'm from Bridgeway. I oversee our supported housing, homeless outreach, and justice involved services. I've actually worked with the homeless population for over 30 years here in Union County, and I'm excited that we are coming to Middlesex County with some services and supports that may benefit some of the homeless population. Sorry. So our RISK team is a residential intensive supported housing team. So essentially it's an intensive supported housing program. In Middlesex County, we have two teams providing the same services to about 120 persons served. To be eligible, you have to have a serious and persistent mental illness diagnosis. That's major depression, schizophrenia, bipolar, things of that nature, and also in need of support services. Traditionally, the referrals to this program have only come from the state and local hospitals. However, over the past couple of months, the Division of Mental Health Services has allowed us to expand it to community providers. And that's the reason why I was coming to you guys today. The person served will be living independently with support services, and I'll explain them. So our services are 7 days a week. We have staff every day, able to see people face to face every day. We do have some after-hour support by phone contact. Our hours go from 9 a.m. to approximately 5 to 6 p.m., depending on the day. And then after hours, our staff can contact our staff by phone. We can link to a person to a housing voucher through the Division of Mental Health Services if we have them available. Our services, we have multidisciplinary staff. We have a fully licensed clinician, partially licensed clinician, master's level, bachelor's level, and peer level staff on each team. Our services include, we teach skills in the area of daily living skills, illness management and recovery, coping and stress management. We do a lot of case management for community linkages and making sure people are following up with their mental health needs, their medical needs, if they have substance abuse issues, making sure if they're going to programs. We work with them on harm reduction. We work with them helping them get back to school or work or go to a program if that's what they choose to do. A lot of all the services really depends on the person served goals and what the goals that they really want to achieve in the community. In general, our services are pretty intensive. Average is 3 to 4 times a week. We have the ability to see people every day if that's what's needed. If a person is doing well and then experience a crisis or a bump on the road, and we normally see them 2 or 3 times a week, then we'll increase it to 5 to 7 times a week to try to help them through that crisis. We do have medical staff on our teams as well. We have an RN and an LPN on each of the teams. We have a component of our risk program is what we call MESH, or medically enhanced supported housing. And so for those individuals that have higher medical needs, like people with uncontrolled diabetes, uncontrolled hypertension, we have 1 or 2 people on the teams that have cancer, and we're helping them through that. So any type of medical issues that the person have, we also work with. We do a lot of training around wellness areas with the person served, because we notice people with mental health issues are dying 25 years younger from the average population because of medical issues. So we do a lot of wellness activities, teaching them about healthy living, healthy lifestyles. We'll take them to the food store and teach them how to eat healthier on a budget. We'll go for walks with them or take them to the gym if they have goals of, getting back to exercise and things of that nature. So we do a lot of areas around wellness with the person served. So we follow some evidence-based practices. We do RAP planning with them. That's Wellness Recovery Action Plan, really teaching them the skills about how to maintain their own wellness in the community, as well as IMR. We do career development with them. Like I said, we'll help them develop resumes. We'll practice job interviewing with them, and help them apply for jobs online, if that's what they choose to do. And really the overall goal of our service is to help that person serve to become more independent. So it's a lot of skills teaching. In terms of transportation, initially we'll transport people to their initial appointments, but really with the eye on the goal of them eventually being able to go to those appointments on their own. Some people that happens a little bit quicker than other people. So we do have availability transportation as well. And we're able to provide the services as long as the person needs our services and are working on our goals. So the voucher, generally there's a lot of questions around vouchers. We do partner with Division of Mental Health Services for housing subsidies. It's administered by the Supported Housing Connections through the DCA office. The person served does need to be receptive to our services in order to have a voucher. So it's not like it's their voucher and they can say goodbye to us and never see us again. They have to be willing to work with us and allow us to help them provide support services to them. We can assist finding housing. It does take a good amount of time. With the new FMRs, we're able to find housing a little bit quicker these days. But generally it takes about 3 to 6 months. So it's not emergency housing. And the person served has to live in Middlesex County with this voucher, at least initially. And like I said, we don't have immediate access to housing, but we do have some landlords that we work closely with the voucher. One of the things that's worked really well in Union County is we kind of partner, our supported housing team partners with our homeless teams and homeless community. And if we feel a person's appropriate for our services, we'll identify a voucher for them, and then the homeless team will help them find housing, and then we'll start taking over services at the point where they find housing. So that's just one thing that has worked really well in Union County. But I just wanted to make that suggestion about. So that's the risk services. I did want to mention that we do also, Bridgeway does have supported education in Middlesex County. The supported education program is a mobile outreach to assist people with psychiatric disabilities to reach their post-secondary academic goals. The services are flexible based on the student need. They provide support counseling. They help them with accommodations. They do referral and linkages to their academic supports that they need, and they do skill development with those things for people attending college. So I did just want to briefly mention that because it is a service available in Middlesex County as well. And then I've included on the PowerPoint our phone number and our fax number. I will email this PowerPoint out along with the referral form. I'll send it to Melissa so she can send it out to you. And that's the gist of our services. Are there any questions?
I have a question. So you talked about, for the vouchers. I was wondering how long they last, because you said, that they can't just take them and go anywhere. It's dependent upon them receiving services from you. So I imagine at some point in time, the client, the tenant doesn't need services from you anymore. Do they still get to keep the voucher?
Yeah, so what the person served has to agree to see us at least once a month minimally to keep the voucher. So what we do is we place them on what we call subsidy only program, and then we outreach them once a month. But that's when they're ready to like graduate, and they, hopefully we've taught them the independent living skills, and we do that. If they do want to move, to another county down the road, as long as we can find another supported housing agency to manage the voucher, they're able to do that. But they have to, the vouchers attached to what they call CSS program, or Community Support Services program, which is essentially supported housing. So as long as another DMHS agency that provides CSS services accepts the voucher, they can go to that county.
Thank you. And thank you so much for coming to share your services.
I'm excited.
I have a question, Nancy. It's Carolyn from Robert Wood Johnson. I have a question. You said it takes 3 to 6 months for housing to occur once they have the voucher. How is your agency housing that person until that subsidized housing takes place?
Well, generally that's how we work with the homeless providers, so sometimes a person might be in a shelter or a temporary living situation with their family or friends and things of that nature. That's why I was stressing it's not like an emergency housing program. We can't get somebody into housing. You refer to us and then we'll have a place for them to live, May 1st. We have to work with them. So we just work together with the homeless provider to figure out what the temporary living situation is until we can get them into a place to live. We've actually reorganized our teams a little bit. So now we have one person that's like in charge of trying to find housing for people. So we're hoping that facilitates a little bit faster because this person already has established a relationship with some landlords. So we're hoping that facilitates the process a little faster, but there is a waiting time.
It sounds like a great program. Thank you.
Thank you.
I have a question too. Thank you for sharing your program, Nancy. We are working with a family and they were homeless, and we have a transitional home. We would like them to transition into some kind of voucher program, and we are looking for one. And I was wondering if this voucher program can work for that family.
As long as one of the adults has a mental health issue.
Okay, and what is the criteria? Is depression considered to be mental health?
It has to be major depression. So if you want, I'll send you my contact information, and we can talk offline specifically about the diagnosis, but there has to be a diagnosis, and the person has to be either have been or currently connected to some type of treatment. Okay.
All right. Thank you so much.
Mm-hmm.
And we had sent out with the meeting packet, there was a fact sheet on the program. So you can share that with other people in your organizations, and also a referral form that can be used. So we'll resend that out again when we do the follow-up with the after the meeting, and along with the PowerPoint. So everybody will have that. Oh, Susan, go ahead.
I have a question. Are the services afforded in different languages? Do you have staff that speak different?
We have bilingual Spanish staff, and we do have access to translation services.
What type of translation services? You have an independent translating program or company? Okay,
Yes, it's a company, yes.
thank you.
Any other questions from the group?
Yes, I have a question. Is there an age limit for your program?
It's 18 and up.
Okay, thank you.
Any other ones? Okay, that's great. Well, thank you so much, Nancy, for letting everybody know about this wonderful resource that's available in our community and that we can hopefully partner with, and that you now can take referrals from other places. So that's terribly exciting for us. And yeah, so it's wonderful, and thanks for joining and being a part of the group, and we look forward to to being more active with you and to have it as a great example of another level of collaboration. So
thank you so
thanks.
much.
All right. Next part on our agenda is our committee reports. So our executive committee meeting next week to look at and review and approve the local application tools. We'll talk more about the local process starting again soon. But the tools would include the application, the scoring tool, and anything that we're looking for performance measures and reports and documentation that would be required as part of the application. For permanent supportive housing, I'm going to go to Melissa Mascola couldn't be here, but she left a report. So this group meets the fourth Thursday of every month at 10 o'clock through Teams. The last meeting they had was last week on 3/28. The agencies present were DCP&P, Coordinated Family Care, Coming Home, Rutgers UBHC, CCC, VOA, Penreach, Town Clock, and Reformed Church of Highland Park, and Mission First. Had a lively discussion with a lot of info sharing focused on moving on, as well as strategies and options to move up individuals who might need higher level of care to other community settings. Consensus is that it can be challenging to move on from permanent supportive housing due to a lack of affordable housing and limited financial resources to move. Agencies have been able to identify opportunities/funding and work together in many cases, but there's still a gap. Coordination, case conferencing, and resource sharing for clients who are ready to move on or who need a higher level of care is essential for success. Coming Home also provided an update on the HIMSS training available through Pathways and encouraged the group to reach out to Malika with any questions relating to HIMSS training or data quality needs. The group also discussed the Built for Zero initiative and updates around connecting with Blaustein School for support with community assessment and focus groups for case management. The next meeting is Thursday, April 25th. They'll continue the discussion on moving on and welcome new members. And you could reach out to Nicole Fernandez, Catherine, I'm assuming that's Jackson, and Melissa Mascola if you would like to join the group or provide feedback. So that is her report. And just for people who aren't familiar, moving on is a process where someone who had received a permanent supportive housing subsidy, so it could be either a voucher where they were placed in a community or they're living in a project-based permanent supportive housing development like Amani Park that MIF operates. And they really no longer need the continued supports that those permanent supportive housing provides, the support services, or they can get support services in the community and still remain stable. It's an opportunity for them to move on to a different type of housing subsidy. So it might be a Section 8 voucher, it might be a mainstream voucher, or a different subsidy as it becomes available. And then what that does is that frees up a spot in that permanent supportive housing part that you can take someone who's currently actively homeless and move it in. So the basic criteria is usually you have to see somebody stably housed for 2 years in your program. And then they would have the opportunity to be considered for moving on. Then they have also apparently mentioned people who may be sometimes in the programs but need more intensive services. So trying to figure out what that might look like. Any questions on the Permanent Supportive Housing Committee report? Hey, Eileen, consumer participation?
Sure. At our last COC meeting, Lane, I forget his last name, Stanley, I think, gave a presentation. He is from Collab Arts, and he's been working with Mission First, which is Imani and Amandla, to create a graphic resource resource guide. And he's been working with the Consumer Participation Committee to both formulate his ideas, his outline, and this last meeting we had, it's April, in March, he had a draft of one of the chapters, and we split into groups, and we gave a lot of good feedback. Always good to get it from the consumer's perspective, to make the language a little bit more colloquial and a little bit more appealing to its intended audience. So we've been working really intensely with Lane on this project, which has been really good, I think, both for him and for the consumers. And the final project won't be out until September. And until then, we're going to be meeting with him virtually because he needs to go back to the West Coast. But so we've been involved in that. And the steering committee hasn't met in a couple months because this project has been outlined for us, and that's what we've been going for. But we'll probably need another meeting real soon to see what our next project will be outside this. And so anybody wishing to sponsor a consumer who would join the consultant committee, please email me because we'd love to have you.
Thanks, Eileen. Any questions about consumer participation? Okay, Homeless Youth Task Force. I don't know if Michael Davidson wants to take it or someone else.
Sure. So we have not had a meeting since the last McKick meeting, so there's nothing really new to report other than to say that our upcoming meeting is May 1st at 2 p.m. Via Microsoft Teams. If anybody is interested in joining who doesn't have their email in my system that populates to them, please let me know. I'll put my email in the chat and get you added to the email list.
Great, thanks, Michael. Coordinated Assessment Leadership Team. I don't know if Eileen or Malika wants to take that.
We had our last. Go ahead. Go ahead. No, you go ahead. I was going to say I can start, but I don't have my notes with me. But go ahead. Great.
I don't either. But our last meeting was a kickoff from, I think the last time the team met was some time ago, but we discussed the expansion of the access navigation and 211 in-person 211 sites, and just looking at what progress has been made over the last couple of months at the 4 various rotating sites. And what we came to the conclusions that we have, we've stopped going to the Aldersgate site. We looked at the data, of course, as to how many people we were seeing at each of these sites, and what type of traffic we were getting in terms of actual people experiencing a homeless crisis at the locations. And we experienced that Aldersgate, we just weren't getting anyone there, so we no longer are at the Aldersgate site. We did pick up Middlesex College, so we are there now. And then we discussed now going to Reformed Church of Highland Park. So we will start going there on Tuesdays. And we'll give a date. We'll be meeting with Lori next week to discuss a definitive date to where we will start going there on Tuesdays. So we will still remain in person at the Y in Bertha Amboy. We are at Unity Square, which has been very successful there. Middlesex College, Metuchen, and then at Reformed Church of Highland Park. And then we also just discussed moving forward, looking at our coordinated assessment tool, and that will be moving forward. So anything I missed, Eileen?
Oh, she's muted. You're muted, Eileen.
How about now?
Good.
Okay. It said unmuted, but who knows? Yes, no, that was great. Does anybody have any questions? And we weren't the only ones there. A lot of people on this call are also participants, so anybody can jump in. Okay, great. Thank you.
Thanks. So next item on our agenda is we're just talking about the HUD Continuum of Care program competition. And it seems like we run from one cycle to the next. So this is where we get a bulk of our money addressing homelessness in the county. We're bringing in over $3.5 million through what has been until now an annual competition from HUD. It's not released on a set time every year. So sometimes it's released in the late spring, other times it's the NOFO, as it's called, the Notice of Funding Available, or Notice of Funding Opportunity, comes later in the year. So we never quite know when it has. The past couple of years, it's been due into HUD to submit at the end of September. So we start a local process. So we have to tell them each year how we propose to spend what is roughly our allocation. And they look at all of our existing projects that we have funded through this program. And we get they look at what it would take to run those programs. Some of them get annual adjustments if they're a certain type of housing programs. They get rent adjustments based on the fair market rent. But they look at how much you would take to run them in the upcoming year based on the current fair market rents. And they said, okay, as a community, you're pretty much we're going to guarantee you 94% of what that funding is to kind of continue operating their existing programs. And it puts up in a competitive process the 6% to get up to 100%, and also an additional 6%. So you can each year potentially grow your pro rata share by being competitive in your application. In the application, you talk about all the things you're doing as a community, as an overall homeless system, how well you're coordinating. But there's a big part of that looks at our system's performance measures. So very set things that they look at, is your homeless number going down? Is your unsheltered homeless number going down? Are people who are in your programs and your permanent supportive housing programs, are they increasing their income? Are people in your shelters increasing income? Some other different measures, but these are all things that are reflected in the IDIS system, the online database. where we capture all of our homeless data. So this is why Malika and her staff are always preaching, you want to make sure you have up-to-date, accurate information in HIMIS and how important it is to do that, because literally that's all aggregated and part of our score. So you see, last year's competition, we got 3.6 plus million for 15 projects. So this was what we submitted back at the end of September. We got notified, I guess, maybe March, late February or March about that. We got the scores sent out. We shared them with our last meeting. We kept them in here again to show you. So we didn't score terrible, but the biggest part of improvement, we were 40 points under the maximum, and 23 of them were in system performance. So if we can pick up points by having better system performance measures, we'll score higher and bring more resources into the community. That's opportunities to have new programs added to the existing ones that we have. So Coming Home submitted our systems performance measures a couple weeks ago. They were due for this past year. Those will be the system performance measures that are judged on this year's grant cycle. So we know that this year's process would be starting sometime soon. We're preparing for it locally with our local applications. So we'll have local applications out. That's what we said earlier, that the executive committee will be reviewing. They'll be probably pretty similar to last year's. So we'll start the local process of accepting renewal applications and new applications, and we'd likely have that out sometime in May. In all likelihood, we'll start setting those dates. We usually give each agency about a month or so, or all the agencies about a month or so to get them in. So we'll have that timed out for you, but you can usually count on a month. Renewal applications have to report on how well they're doing on their existing grant. Are you spending the funds? What are your performance measures? So you have some data that we look at that comes from HIMIS on how well you're doing, and that's evaluated by a local group called our Technical Review Committee. So that'll be happening. This year, as you know, Congress just recently passed the budget several weeks back for the HUD programs. So we didn't have a government shutdown. But one of the things they put in is that they gave permission to not have to do this process every year, but to do it every 2 years. So I'm assuming that they're going to take this in account. This year will be one of the years they have to do it. But then that next year, we might not have to go through this and have this whole process. What that does is that does two things, good and bad. So the bad part is, however we performed right now, we're probably locked in for a 2-year period. So gains that we're making in the upcoming several months, where normally they would be into effect for the 2025 cycle, probably won't really be considered until 2026. But it gives us an opportunity to really expand and really make a lot of good planning, good decision makings, adjustments to the program, and increase our performance. Sometimes it feels like, we have all these plans you're going to hear about in our next agenda item with Built for Zero, and we have capacity issues because the people trying to implement them are also trying to do a lot of the other things that happen as part of it. They got to do an application to submit their renewal applications and make sure they're getting their agencies to do data cleanup, and they're serving on other subcommittees, and it just makes it tougher to do. So we're going to have to look at this as an opportunity. We can't change what the system performance measures are that we just submitted, but we can look at them, see where we're trending, see what we need to improve upon. And some of that we're already really doing in our goals for Build for Zero. So we're heading in this direction. So we really have an opportunity over the next year and a half, almost not quite 2 years, to really be in a great position to make a big jump and bring some programs in. We'll still score pretty well this year, even if we haven't improved a lot on our system performance, because we have a really good continuum. So we still expect to be pretty competitive, but this means that in 2026, we can really be in a position to knock it out of the park. Kind of thinking very long term. And that sounds like it's really, really far away. But remember, the 2026 cycle of this competition will be relying on data that we perform in next year. So we really want to keep this momentum going and make sure we keep driving numbers down. The numbers that are supposed to go down are going down. The factors that are supposed to go up, go up. And we really just make a concerted effort to work on that. Because next year, we're not going to have to go and spend all these different hours in staff capacity and time on a local process. So we'll do it this year. Know that this year then is going to be probably, you'll have a break for 2 years, but we're going to ask you to then really help us drive the system performance. Ashley or anybody else, I don't know if there's anything else to add to that. Michelle, anyone?
I just would like to say, if anybody is not looking to apply and you want to help with the TRC, please let me know. We had a good group last year, but always looking for more people to participate.
And Michelle, give them a quick minute of the expectations of what the technical review committee members are expected to do and what that entails.
Sure. So last year we actually started to do things a little bit differently. So what we do right now is the renewal applications are due back before new applications. So we review those applications first. So instead of, there's different scoring for different types of applications. So we focus on renewals because, as Melissa said, we're also looking at their HIMIS data and how they're performing, which is different than obviously a new application would be. Everything is done online. You will receive logins and links so you can go in on your own time, review the applications, score them, and then we as a committee would meet on Teams with Casey from Monarch and review the applications, and we decide how we're going to score them, discuss them, but we review them on our own time, and then we meet just to go over how we scored. We used to sit in a room with piles of applications. Mike Gildenberg can attest to this, and spend an entire day reading through applications, and it was exhausting. And everything kind of starts to blur together, and this is just a much more, it's an easier process to do it this way. So you'll do renewal applications would go first. It's a lot. So this is, Mike, you can even say if this is easier. Steve was there last year when we did this new process. So, you reviewed the applications on your own, and then we met collectively, discussed what we saw, if we had any questions. That way we can go back to the agencies and say, hey, the committee wants to know, what's happening here, what's going on here, what are you doing to improve this? And then when we did the new applications, you reviewed those separately, scored those separately, and then again, we met one more time just to kind of go over them. And then at that meeting, we also collectively scored all of the applications and brought that to the executive committee. It sounds like it's a lot of time, but really reviewing the applications, it's not, it's very simple. They're all in PDF form. You just go online, you look through them, the questions match the scoring tool. We've worked very hard on the executive committee to make sure that that happens. So you just kind of go through, and then if you have any questions, you just make notes, and as a group, we discuss it. So if there's anything you weren't sure about, you know, we would meet and discuss it. We also have a quick meeting before the application links are sent to you, just so for anybody who hasn't done this before, Casey will give a brief overview of the applications, the different scoring tools, and answer any preliminary questions you might have. I don't think there's really much else. I mean, like I said, Mike or Steve, if there's anything, as people who participated and helped score, if you have anything you'd like to add.
It's a great way to learn more about the community and the different programs.
I mean, it's really helpful for us as the committee because, you as people who work within the community, you know what you're seeing as even gaps. So when new applications come in, you have an idea of, what you're seeing might need gaps. And so you'd be able to give us that insight. We had Eileen helped us have some people from consumer participation participate last year. And that was great because having people with lived experience, look at these applications and let us know, hey, this seems like a good idea, but, for us, this would be better. And so it gives us a really good insight to what we're looking for because, and like Melissa said, this is going to, if we go forward with this, it's going to be 2 years. So we're really going to be locked in to whatever we award this year for the next 2 years. So a bigger group, people with, more experience would be super helpful, especially this year.
Great point. And thank you to all the members of the TRC who previously served and took the time to do that. They really, in general, do an excellent job. So it's greatly appreciated. Any questions on the competition? If you're thinking about applying or you are curious about it, we will be having a technical assistance workshop, but you also can reach out to Casey is our main point of contact with Monarch Housing. Ashini's on the call today, but you can use them for questions just to see and start thinking about if the project or program you want to do would be an eligible use for the funds. There's also something called the HUD Exchange. You can Google HUD Exchange and they cover different HUD programs, including the Continuum of Care. So that's another good resource just to kind of find out about the programs. But if you're thinking of doing a project, then you'll want to start that planning now. All right. Now the excitement, we've been mentioning it a little bit. Built for Zero, next steps. I'll kind of start it and kind of do a recap of where we are and what's our next part. So Built for Zero is an initiative that we're working with an organization called Community Solutions. They work with different COCs to drive down your homelessness in general for either you usually start off addressing like chronic homelessness or veterans homelessness. End homelessness for those populations, and ending homelessness doesn't mean that there's never another homeless person in those categories, but that you have enough community resources that when you have a homeless person in either of those categories, you have the resources in place to help them that they don't really stay homeless for long. So it's not that you'll never have homeless people again, but you have a system that can easily manage it and work people through. So once you solve homelessness and get to lower numbers for those populations, you kind of do it for all homeless populations. So we had an aim of we set an aim to overall reduce homelessness by 25% from January 2023, because we set this before we had the current point in time numbers. We were at about 660 people. to under 500 people, no more than 495 by the end of December. Now we realize we might not hit that goal by the end of December, but you heard me kind of say we know we're driving this. So we set an audacious goal to hopefully start moving in that direction. So on December 2024, if we don't hit that target, we're not going to say, oh, well, we tried. We're going to say, no, look what we did. We're down this percentage. So we know these things work, or we're going to try some different things and we're going to continue shooting for that goal and to get to that number. So we, in doing this aim, we set 3 major goals. The first goal was increasing housing placements. We heard even when Nancy gave her presentation, even when people in her program get a voucher, that doesn't mean, oh, great, everything's easy. They have a voucher, because having a voucher, you still have to find housing for that person. You still have to get over all those hurdles. You're competing in a market with a low vacancy rate and high rents. And what the voucher programs can pay is not always the highest rent. So there's a lot of challenges with that. So even having the resource of a voucher isn't the end all to be all to help someone get housing. So housing placements is making sure people who get those opportunities can quickly be housed, again, freeing up capacity for others. So we had some strategies we identified. And then we had a meeting on the 26th in person that was separate from this meeting, where we had 3 groups kind of get in discussions to hit some of the different strategies. So we focused kind of on 3 areas for this goal of increasing housing placements with housing steps, looking at expanding housing opportunities, enhancing support to stakeholders, and optimizing case management services. So those were kind of the 3 work groups that came out of this meeting. And if you remember at last month's meeting, Eileen was very animated and kind of like, all right, we need people to do the work. Who can do this? Who can do that? And this recap was all the things that people had said they would do and work out. So some of them I know, I'm looking right here. I'm going to draft some talking points for some different people to approach the PHAs. I haven't done that yet, but we'll commit to getting that done over the next month and have that out so we can start with that. But some different strategies, and these are really hard, fast, concrete action steps that could be taken to help do that. So that kind of sets this goal and is putting some responsibility on different members of the community who maybe aren't really directly connected a lot with us, but they can step up and do a part. So that's going to move on, and that's kind of continuing, and we're working on that, getting that there and having these resources happen. So we'll keep revisiting that and checking on the status, see if there's other things we can ask, but then we kind of have people who are doing those groups and the actions that they're doing. Now we have to do that for the next 2 goals, which are reducing chronic homelessness and then decreasing system inflow. Chronic homelessness are people who have adults in a household. It could be in either individual or a family who have a disability and also have been homeless for at least 12 months, the 12 consecutive months, or have 4 episodes of homelessness over the past 3 years that total 12 months. So you might have people who are homeless kind of on the street during the good months, but then in the summer, maybe they take advantage of some kind of temporary shelter. So, maybe family takes them in a little bit over the winter. They don't want to see them outside, but so they're technically not homeless then, but they do something and, peeve that person off and they're homeless again when the weather gets nicer. So if it's usually people who are homeless for a consecutive year, Sometimes what happens, you have somebody who was street homeless for a certain period of time and then they're placed in the shelter. So even though they're in the shelter, you know, let's say there were 6 months were unsheltered on the street when they got their shelter placement. Well, if they spend 6 months in the shelter, they've now hit that 12-month period. They're considered chronic homeless if they have a disability. So sometimes people age into chronic homelessness. Sometimes they've been homeless already once we've encountered them. They've been on the street for more than 12 years or 12 months when they start accepting our services. So we're looking for potential participants to work with this work group. If you're with street outreach type of programs, mental health agencies, this is a really substance abuse programs. This would be a great work group for you to take a part in and think about what you can do in your program to help us drive this number down, to help address this. You know, Nancy, by giving her presentation today and making us more aware of the WRIST program, that's a wonderful resource that maybe a lot of us weren't aware of before. We didn't really have great access before because it had to come through the state. So that's a wonderful thing. And I'm sure there's a lot of people on here who are like, hey, wait, I want to work with this program, or I want to see if we can get my client a DMHAS housing voucher and help get them off the street and work with that. So we're going to look for people to be a part of that group and some suggestions for it. I'm going to ask you to hold a second and then we'll go to the next group, which is decreased system inflow. So this is people who are becoming homeless for the first time or are returning to homelessness. They were previously homeless, they were housed some way, maybe with a voucher that they're losing, maybe they got an affordable housing, but then they're at risk of coming back into homelessness. Maybe they've lost some income, got behind on bills, kind of put their head in the sand and didn't really reach out to help, and now they're struggling to become homeless again, or struggling and looking like they could return to being homeless again. So potential participants in this work group would be if maybe you run a prevention program, or a diversion program that you've received funding for. You work with people, you're a permanent supportive housing provider, and you're working to help keep people currently housed. A lot of the system inflow is identifying who's most likely to end up homeless if they become evicted or have a problem, because not everybody who becomes evicted ends up homeless. So you want to make sure you're targeting your resources. So what can we do to help people? Is it just that people don't know that these programs exist? Do the programs have really strict criteria because of the funding source? Is there workarounds to that? What can we do? Are there ways maybe we can prioritize certain people who might end up homeless that allow them to get fast tracked into service? What do we need to do? Do we just need to make more people aware of the prevention and diversion resources are out there? So those are all the different things that people working on decreasing system inflow would work on. So what I would ask now is, and we had a few people who offered when we put this out originally to be part of the work groups. But now we would ask people kind of think about yourself, your agency, who may or may not be here at this meeting, who would be a potential participant for a work group. So do we have anybody who's interested in maybe working on the chronic homelessness work group? And thinking about that, who hasn't previously identified themselves. Or how about system inflow?
Hi, it's Nancy. I can help with the chronic homeless work group.
Thanks, Nancy. We'll make sure we include you in on that.
Yeah, this is
And
Pam from CSP. I definitely would like to join that as well, if that's possible.
absolutely.
Thanks.
Great. Thanks, Pam.
Yeah.
So anybody else?
Denise, excuse me, it's Lori. Denise had to get off the call, but could you send her information about the one that's
System
doing the
inflow?
decreased system inflow, you know, the diversion and stuff? I can't say that she'll be on the committee, but at least she'll have the information.
Yeah, and you know, it's we want to ask people to do, and what this is, and kind of the goal might be, is people who are already doing this work, to kind of come together and say, hey, you know what would really make my job easier would be if we had this resource, or I'm doing this and this has really worked. So it's a lot of peer-to-peer learning too. Lisa, go ahead.
So I have a question. So are you open to non-members, but from our prospective agencies?
Absolutely.
Okay.
Yep.
Thank you.
Yep. Yep.
I mean, we may have like staff members who have some professional development goals that may fit into this, and so the exposure may even be good for them too. Okay, so I just wanted to put that out there. Thank you.
Absolutely. And we'd strongly encourage that. Yeah, this isn't necessarily just the people who come to these meetings. We really want to get down, because the best answers from us, what we always know, comes from the people who are best closely connected to the actual work. So your case managers who are actually meeting with people, because I really don't know the best way to help reduce chronic homelessness. I don't work directly with that population. I don't know what the challenges are in the day-to-day jobs. So we need to be told and made aware of it, and if there's something we can do to help address that. So that's what we want to really attempt. So we want to hear from it. If it's like, you know, gee, you know, if we had this, and we're hearing that from 2 or 3 different agencies, case managers, then we realize that's a gap that maybe we weren't as aware of. You know, sometimes people think there's, you know, it doesn't matter what I do, no one kind of cares, or it is just what it is. But you don't know until you ask, and see what we can do. So go ahead, Eileen, please add to this.
Yeah, I just wanted to say a few things because I have to jump off. And as Melissa said in the beginning, you know, that we're trying to move this forward, but we also have a ton of other things to do. And she mentioned, for example, her write-up of draft talking points to PHAs. There's a lot of other things under next step recaps from our last meeting that Michelle Gravel nicely wrote out for us, and wanted to keep them in the agenda so they'd be right in front of us. It wasn't for naught, right? So the work that we did last month at our in-person meeting is not for naught, and there will be formal follow-up. Some of it, this is going to be from me as well, to make sure that we keep moving this forward, and we definitely need your help. But what I wanted to say is, at the same time that we're doing this Built for Zero, and this is the next thing on the agenda, we're doing the New Jersey DCA 3DM project. And in lots of ways, they're intertwined. And so we've been really focused on doing that. And they are both Built for Zero and the 3DM. Emphasis is on using data to identify the nuances of people's homelessness, make your plans, and evaluate the plan that you implemented, and then do something about it. Either continue it because it's working great, or, you know, tweak it or drop it and kick it to the curb and do something different. So it's all about data-informed decision-making and evaluation. And they are both that. So we didn't want to get caught up where we have a grand goal in the Built for Zero of reducing overall homelessness by 25%. We did take the discrete goals, the 1, 2, and 3 that Melissa detailed for you, and are using them in our 3DM. And so the group of us, and there's 7 of us, the Middlesex 7, the group of us who are involved in that have a presentation to make at Harvard on the 16th, I think it is, right, of this month. And so we're working really hard with, and poor Talon, who jumped in after our first data analyst had to resign for personal reasons. So he had to learn HIMSS, and now he's working really hard with gathering the most important data, and we're looking at it daily. We have a big meeting this afternoon again to see, you know, to see what we can look at, and specifically for the 3DM. We don't have the overall goal, but we're taking one of the discrete ones, which is to look at the length of time someone spends in our system from entry to exit. And then we're going to disaggregate that by program and then look at the characteristics of the clients of programs and to see if that is the reason therefore. Look at our data in comparison to other counties and other COCs. So we're working really hard on that. So it's not like we dropped the ball and that your participation didn't mean anything last month. It's that we're working really hard on the 3DM, and we're definitely going to reintegrate them after we do, or at least from my perspective, because as you said, we can't do everything at once, after we do this presentation in April. So is there any questions about that? Because I do need to jump off pretty soon.
Susan had a question in the chat and just asking us if we can send an email defining the work groups and include the time commitments and a contact person. So we'll have Michelle and I we'll work on getting that out to the group. We'll probably do that maybe as a separate email that can be forwarded then to you know, to different people you can forward within your agency or whatever. So we'll do that as a takeaway from this this meeting. And then we'll probably look once we kind of identify those people next week, we'll probably ask you know, that group, but we'll throw out a few potential meeting dates and see when people want to, when they want to meet and what we can do. These are really probably need to be an in-person type of meeting to really have the good interaction. You kind of need a face-to-face with that. So it definitely works much better. But we did the first work group. We just did a couple hours together. So I think you can plan for like 2.5 hours or under 3 hours to make that happen. So we'll do that. And thanks for that suggestion, Susan. Any other questions on this or the groups? Eileen kind of talked about our 3DM project with the state. So we'll be up in Cambridge at Harvard for our big closeout of the learning session part of this. It's been exciting being having the Harvard Government Performance Lab people facilitate this and getting us in a good direction. So we'll give you that full recap at our next meeting. We'll have been back for a couple weeks then. Eileen, we're up to agency announcements. Other business, do you have anything else you want to add from coming home?
No, no other business. 3DM is our business right now. Yeah.
That's great. Any other agency announcements, updates, information?
Hey, Melissa, it's Melissa Lewis.
Oh, go ahead, Melissa Lewis.
I just wanted to share with folks, a lot of people have heard this in different meetings, and I believe we've shared it here before, but the county has launched their behavioral health navigators. There should be a marketing campaign coming in the next few weeks, but we have staff on hand to help individuals navigate the behavioral health continuum. So they can be reached via phone at 732-745-3810 or via email at behavioralhealthnavigators.com. This doesn't replace any, you know, crisis hotlines or things like Reach NJ or the IME. It's really designed to help people that need assistance moving through the system or even figuring out like what they need to do and how to move forward. So I'll put those contact numbers in the chat.
Thank you. That's great. Any other updates, new business?
Hey, Melissa, Steve Nagel.
Hey, go ahead, Steve.
Thank you. One off subject for some of us people that are longer tenured. Former HSAC chair Rosemary Orsley passed away earlier this week. Her funeral is next Monday at the Zevowitz Gowicki Funeral Home in Perth Amboy, 4 to 8.
Thank you for sharing that.
She served as our HSAC chair for 8 years.
Okay. We'll make sure make sure we can share that information and maybe have Michael can share it with the current HSAC members. I don't know how much of an overlap there was or there is still with people on there, but we want to give them that opportunity. So
Absolutely.
sorry to hear that.
Thank you.
Any other agency updates? Anything going on with agency we want to know about? All right. If not, you always a reminder, if you have things of interest that for the group, you can send them to Michelle Grabel and she can send them out to the group. That includes things like even if you have fundraisers or whatever else that your agency is doing that might be pertinent to everybody or anybody, we want to share that out and spread the word. Last call on anything going on?
Well, it wouldn't be a McKick meeting if I didn't make a plug for the diaper bank. So we're actually not doing open distributions anymore, but clients can come Monday through Thursday from 9 to 1. Just a reminder that if they've gotten diapers within the past 2 months, they won't be eligible again. If it's their first time, they have to bring birth certificates or some documentation, maybe on an agency letterhead as to the number and dates of birth of children in the family. And also because of funding, we have to cap the number of clients that we work with each month. So folks should try to come earlier in the month if they can.
Thanks for the info.
Hi, good morning. It's Carolyn. I'd just like to share with you that April 21st through the 27th is National Crime Victims' Right Week. And we know that a lot of the clients we work with who are facing homelessness are also victims of crime. So I hope that you acknowledge that week and if you're working with clients that week, keep that in mind. Thank you.
Thanks for sharing that. Anyone else? Okay, then if not, we'll take a motion to adjourn.
So
Thank you,
moved. Motion
Sandy.
to adjourn. I'll
Okay,
second.
that'll work. Well, we're all in favor of adjourning and ending the meeting early, so that's good. Thank you for your time on this. We will see everyone next week or next month. So take care and enjoy. Hopefully, a change in nice weather by then. We should be fully into real spring. So take care. Be well.
Thank you.
Thank you very
Thanks.
much.
Bye-bye.
Thank you, Melissa,
Thank you.
for hosting the meeting. Thank you.
Thanks.